In this brief presentation, we will go into some recent developments in understanding the arterial contribution to blood circulation. As you are probably aware, blood circulation is essential for life. The blood brings nutrients to body tissues and withdraws any waste products. Other systems for homeostasis within our body readily profit from the constant circulation of blood: the thermoregulatory system, the hormonal system, and the immune system. One organ may produce substances released into the bloodstream and reaching other organs for steering their activity. The blood circulation as we know it is the product of billions years of evolution. We shall not underestimate its sophistication and complexity. In a way, the evolution of blood circulation can be mirrored to the development of modern transport, a long history of trial and error leading to machinery that was unthinkable even a few generations ago. Thus, our understanding of the human body builds upon concepts and theories postulated or proven by our ancestors, very much similar to modern transport developing over centuries by human curiosity and creativity. What works remains, and what fails dissolves in the course of time. There was a time that all transportation of goods over land was by chariots, either powered by horse, ox, or human. In this time, Galen lived and worked on the foundations of current medicine. Partly he fell back on Hippocrates, partly he performed own investigations and observations. Galen believed that blood was made in the liver and brought to the heart by vessel relaxation, the blood not circulating but pendulating between organs. In the heart, the blood received its life spirits before it was transported to other organs. Many centuries later, long-haul transportation was largely done by tall ships, such as those sailing for the West Indies Company, bringing exquisite and exotic goods from China and Japan to Europe. The profits earned by selling these goods was tremendous and led to the Dutch Golden Age. In that time, Harvey realized that it were not the vessels which were responsible for blood circulation, but it was the heart that was able to pump the blood from the veins to the arteries. He postulated that throughout the body there would be tiny channels or capillaries that allowed the blood to flow from arteries back to the veins again. He was the first to propose that blood circulated through the body. Harvey was very explicit about the role of the arteries. He saw no function for arteries in blood propagation, presumably because he had to oppose his contemporaries who based their views upon the doctrine of Galen. Then again, it took centuries for self-propelling transportation to occur. With the development of steam engines, persons and goods could be transported almost effortless from one place to another. In this era, Otto Frank coined the Windkessel theory, a theory that viewed the arterial system, especially the aorta, as a capacitance containing blood at high pressure that would flow out via the capillary systems of the body's organs to the venous side. Schematically, the arterial system could be sketched as in this slide. Over years we have accepted the arterial blood pressure as the indicator of pressure within the Windkessel. The monitoring and control of blood pressure has become the most important goal in modern intensive care medicine. Of course, arterial blood pressure is pulsatile and increases when blood is injected by the heart, called systole, and tapers off during the relaxation phase, called diastole, because of ongoing leakage of blood from arteries to veins. There were some observations, however, that remained unexplained. Counterintuitively, the pulsatility in the arterial system increased towards periphery, the difference between systole and diastole becoming greater the further away from the heart. Also, careful studies of the arterial blood pressure rise during systole showed that the front of this wave accelerated towards periphery. These observations required a firm explanation. That became available over the years that the first planes took off from Earth. Everyone knows how this was the beginning of true globalization. World inhabitants are now able to travel from one continent to another in slightly over 24 hours uninterrupted flight time. Grashey and von Kries formulated the theory of arterial stiffness, which stated that the pressure wave elicited by heart contraction was transmitted along the arteries but reflected by distant points of high resistance. So any blood pressure measured proximally was the sum of forward and backward traveling waves. This is represented graphically in this slide. The narrowing arteries of the arterial system can also explain why the propagation speed of the wavefront accelerates and why there is an increase in pulsatility, because the propagating wave is enhanced by recurrent waves. Or in the simulation, blood energized by heart contraction loses this kinetic energy due to the stiffness of narrowing arteries. After 3.4 billion years of evolution, this is truly a disappointing conclusion. This year we were all baffled by the first commercial flight financed by rich visionaries such as Elon Musk and Richard Branson. The technology behind spaceflight has become available to the general public, and commercial visits and deliveries in space have now become feasible. Once again, returning to our main subject, the true shape of the arterial tree is not a large capacitance with small outflow arteries. Instead, we know that the total cross-sectional area of the arterial system increases manifold on its way to periphery. The cardiovascular system can be seen as a funnel. The pulsating energy delivered through the small cross-sectional area of the aorta may be expected to dilute along the arterial tree. No way the arterial blood pressure can maintain its pulsatile energy, as demonstrated by this young boy trying to extinguish a candle by blowing through the narrow end of a funnel. There are more problems with the theory of arterial stiffness. When arterial resistance is so high, why does the blood not flow through the proximal capillaries only, since this is the way of least resistance? How can it be ensured that blood also reaches tissue with less favorable conditions, such as your buttocks when sitting in a chair? We now know that there is a thick layer of circularly arranged smooth muscle cells within the arterial lining. We also know that smooth muscle cells are electrically connected by extensively distributed gap junctions. Furthermore, we know that smooth muscle cells depolarize in response to stretch. In 2014, this has led to the theory of arterial acceleration. Arteries do not oppose the pulsatile energy of heart contraction, but instead, during stroke onset, a wave of depolarization travels along the arterial tree, distributing along its branches. And since depolarization leads to calcium influx and thus contraction, a peristaltic wave is generated, enabling the energy generated by heart contraction to reach into even the most remote capillary systems. In a schematic representation, the blood ejected by the heart is accelerated along the trajectory of the arterial tree, explaining the acceleration of the pressure front as well as the increase in pulsatility towards periphery. Now there are still great advances possible in the transportation of people and goods. Likewise, the theory of arterial acceleration can by no means be the last word in this ever-increasing understanding of the cardiovascular system. New questions lie ahead, new observations are to be made. Possibly you will take up this challenge yourself and further our knowledge regarding this intriguing part of physiology. Without hesitation, such improved understanding will lead to a more focused treatment of our patients on the ICU.